My research was done on organ scaffolds being used as an alternative to organ transplantation. The availability of organs is a big issue for patients who are on the wait list for transplantation. A majority of patients on the transplant list are terminal and need a transplant quickly. Organ unavailability is due to not having enough organ donors and also immune system markers that make the donor's organ not a good match for the patient. There is a high demand for organs and not a great enough supply because there is no consistent source of organs. There are over 109,000 men, women, and children who are all on the wait list for organ transplants. Organ rejection puts these patients at risk when receiving and can oftentimes worsen their condition. Organ rejection occurs after a transplant and is when your body attacks the new organ as a foreign object. The patient can experience acute rejection, which happens after the first few months of having a transplant, or chronic rejection, which happens any time beyond a year. To manage the organ after surgery, the patient must take organ rejection medication for the rest of their life. Rejection medicine, also known as immunosuppressants, prevents the body from rejecting the new organ. To have a successful transplant, medication needs to be taken daily. The patient needs to attend all doctor's appointments and complete lab tests. Organ transplants require a lot of maintenance to avoid infection and rejection. Many patients die before they can receive an organ because they experience organ failure, but new techniques, such as regenerative medicine, can restore damaged organs and make them viable for use once again. Regenerative medicine is offering new hope to patients waiting for organs because doctors are able to develop therapies for tissue engineering and reconstruction. These studies use stem cells that are unspecialized cells, which are pictured to the right, to form new tissue. All stem cells start the same, and they help to repair tissues as well as create new cells. This is a major key in the production of organs because using stem cells reduces the risk of the organ being rejected or damaged in the body. Damaged cells and tissues can be turned into healthy tissue through the use of stem cells. Some conditions, such as Parkinson's disease, spinal cord injuries, and burns, have been helped with the use of stem cells. An example of regenerative medicine is scaffolding. These are 3D templates that are used to produce organs with the use of stem cells. To make a scaffold, there is a decellularization process that leaves a basic framework, and then recellularization, where the stem cells are added to the scaffold. The scaffold is then incubated so that the stem cells can mature and specialize, so that it can function like the organ it is supposed to replicate. This results in a custom organ for the patient. The whole process of decellularization and recellularization of the organ scaffold is depicted to the right. In 2006, Dr. Chung performed the first organ transplant with stem cell technology. There have been many successful scaffold transplants with more simple organs such as the bladder. But more studies are being done for more complex organs such as the heart and lungs. Some benefits of organ scaffolds are that they increase the number of viable organs. They can also decrease the risk of organ rejection because they are customized to the patient's immune system. This is really important because that means that the patient would not have to take the immunosuppressants every day for the rest of their life. Lastly, it reduces the risk of the organ being damaged or attacked by the patient's immune system. The hope with this regenerative medicine is to no longer make patients wait on the transplant list so that their conditions can not get worse over time. And this technique will eventually be able to replace organ transplants altogether.